From Fox 5 News, this is Good Day New York.
Speaking of hair, coming up, the mysterious condition that causes it to actually fall out.
Yeah, it's called alopecia, and just ahead, we are talking to two doctors about the latest treatments to help combat this. Stay with us. We'll be back after the break.
Alopecia is an autoimmune disease that causes hair to fall out of people's heads who suffer from it. So much trauma, and they usually try and keep it a secret. A Massachusetts representative, Ayanna Pressley, is opening up about her battle with hair loss. Her recent announcement, it was published on The Root. The congresswoman revealed that she is completely bald. She decided to go public to help others living with the condition.
And joining us now, two doctors who treat alopecia, Dr.Yael Halaas, a board-certified plastic surgeon, and Dr. Palep, a dermatologist. Now, she treats patients with the condition and also suffers from it herself. Good morning, ladies. Thank you for being here.
Good morning.
We mentioned 68 million people will experience alopecia through their lives. This is such a massive deal, and yet, like you said earlier, we don't get to talk about it enough.
Yeah, it's amazing because it's affecting. Men were aware; they often show that they're balding, but women are suffering from in tremendous numbers. Actually, over 70% of women are going to experience distressing hair loss as they approach and after menopause. So this is really widespread, but for some reason we haven't been talking about it.
Oh, I think so much is centered around our hair. Even when the congresswoman was revealing that she had alopecia, she was talking about how it's a political, in her world, a political. She said that she has colleagues that are told, you know, you have to how to wear your hair. Even colleagues who don't suffer from it but may have gray hair. That there's so much more pressure on women to be able to have whatever we think is the conventional look, and so you hold it close to the vest and you don't share it.
And on a daily basis, I must treat 5 to 10 women for hair loss on a daily basis. So Ayanna Pressley, what she has is a more extensive form of a condition called alopecia areata. About 5 million Americans, the statistics say, are suffering from it in America alone. And she
How do you treat it?
So I actually had alopecia areata myself, and it's very stress-induced. So the first-line treatment for it is to do intralesional Kenalog injections.
And what is that?
And that is a steroid. It's called triamcinolone, and we inject it into the scalp, and we see the patient once a month, and usually by the third treatment they're starting to regrow hair. So it's basically your body is fighting your own hair follicles, and you're using the steroid to bring down that inflammation so the hair can grow back. And it usually works pretty well as long as the stress or whatever kind of put them into that.
Is it hereditary?
It's not necessarily hereditary unless there's an autoimmune background. It could be stress-induced or autoimmune. Ayanna Pressley has the more extensive type, which is the totalis, where you lose all of the hair.
What is something going on a bit more general? You're seeing a lot of people come in that may not be the complete, destruction of the autoimmune, but you're seeing the stress and stuff like that. I mean, how are you dealing with this besides you're mentioning the steroids?
Telogen effluviums are your everyday. That's one of the most common hair loss that you see in women. I've suffered from it myself. Most women after their pregnancies, they lose almost 50% of their hair. And it's scary. Even being a physician, when it happens, you know, you're like, wow, it's dissettling. You will oftentimes get your hair back, but we do therapies to try to bring that back.
So one of the most common that really is going to be affecting really possibly all of us is the more typical androgenetic. It's the hormone and genetic hair loss, and that can happen to everybody. That's what you're seeing with men who are losing their hair, and you're seeing it with women as well. And whereas with men we're always very quick to suggest hair transplants, with women there are many other options and can be a little trickier sometimes when it's right to do a hair transplant.
Yeah, I was reading, is it Matt Lucas? He's an English actor who also suffers from it, because I think we have the tendency to think of it as being a woman's problem. Is there a way though to prevent it? I know that Sapna, you talked about you can get the hair growth back, but I hear that even sometimes if you get it to come back, it still falls out.
Right. So there are a lot of supportive treatments now that can be very helpful. Both of us in our practices, I'm sure, are using a lot of vitamins. There are new treatments coming out. But what we're the real cutting edge is really regenerative medicine. And in that we're using things like platelet-rich plasma, stem cells, exosomes, and using your body's own powers to regenerate to keep the hairs there. And the nice thing about those treatments is some of them can be done. For instance, right now we're seeing some pictures in my practice from using stem cells and
So what
exosomes.
do you do? Do you inject the spot? Do you...
So for these treatments, in general, we're treating the entire area where we're seeing loss and areas where we're maybe anticipating loss.
Right.
The nice things with these treatments, especially nowadays, they're actually done with injections. But
Does the hair grow back gray or the color is...
I actually do PRP myself.
Do you?
I have androgenic alopecia, so I'm in my maintenance phase. So the treatment protocol that we come up with once a month for 3 months and 6 months thereafter, and it works amazingly.
Because to look at your hair right now.
So I have more hair in my 40s than I did in my 20s.
I'm looking at some of these pictures right here, and
yes.
you wouldn't necessarily say, you know, they are losing their hair, but so you can tell by looking at some of these pictures and saying you may be dealing with alopecia, you may be dealing with this stuff. So if
you see
were
the
able to...
part is widening.
Okay.
So that's a sign of androgenic alopecia when the part is widening.
What about when you're taking a shower? And I don't know if you do, it's like you're you know, taking a shower, you have clumps of hair come out. When do you need to be worried about something like that?
A normal amount of hair loss is about 50 to 100 hairs a day, and everyone's average is going to be a little bit different. And so I have my patients do a hair count test, which is over 24 hours. So I have them wash their hair, get rid of all that hair, pull out everything from their comb, then they start counting their hair from that moment to the next 24 hours when they do another shower. And that is a pretty accurate count.
So what piece of advice would you give someone right now if they're seeing these signs? What should they do?
Go see someone. Go see a dermatologist and get lab work possibly
even a scalp biopsy.
Yes, exactly.
And then also good nutrition is very important because sometimes, especially with women, if their thyroid is a little out of kilter, anemia.
Know your overall
Vitamin
health.
D deficiency, 75% of the women do lab work.
Though it can be difficult to be stress-free in New York.
Yeah, right. We're living in the wrong place. How can people find you, doctor?
You can go to my website, www.drhalaas.com.
Okay, and Dr. Halaas?
www.springstderm.com.
Beautiful.
Thank you
for
guys
being
so
with us
much
this
for being
morning. We
here.
appreciate it. Good information.
Thank you.